Dr. Cameron, what is going to happen to someone who not necessarily is having all their teeth taken out, but say we've had an accident and perhaps we've knocked the front of our teeth, the front of our mouth, and maybe we've lost 3 or 4 teeth at the front. Are implants still a viable option for that kind of situation?
Absolutely. So if you're missing multiple teeth, you really have 3 long-lasting options, okay? And I'll go from what I recommend first. First would be implants. Now that can be multiple implants. Let's just say for argument's sake you're missing 3 teeth. Okay, it could be 2 implants with a bridge over top of them. That would be ideal. Okay, you can also say I want to do a long bridge. You're going to be involving multiple teeth on both sides if you're missing 3 teeth like that. Okay. Or you can do a partial denture, something that you put in, you take out. That's also in the order of who's happiest. People that are the happiest people we see are the ones that get it fixed with the best solution. You know, implants that are stable, it doesn't involve the rest of the teeth, and it just stays there. Bridges are also a good option. The longer the gap, the harder it is to do a bridge, just because of the physics of it.
So what do you mean when you say a bridge? Is it like a piece of metal, for example, with the teeth attached to that?
Sort of. So you say a simple conversation, what most people are familiar with, you're missing a tooth, and then we shave down the teeth on both sides of the gap, and then we cement a bridge, and it's all one unit, but it relies on those 2 teeth to replace the 1. So that's why you're involving other teeth to fix the problem of the missing teeth. So there's always some pros and cons to that. With trauma, you just got to figure out what's best. Most people that are missing teeth, you know, it's from some oral health habits that weren't the best, maybe when they were kids, or, you know, they've gotten better, but they lost it for a reason, right? And so involving other teeth to fix the problem you had with other teeth isn't always a winning solution. I mean, if you had a hard time taking care of the first ones, are you going to take care of the next ones any better?
Chances are possibly not, you know.
And it's harder to floss around to take care of anything foreign. Right. But especially when it's glued in there like that, like a bridge involving multiple teeth, it's going to be harder to floss.
And are bridges typically with multiple teeth, are they glued into place, so you're not sort of popping them out like a denture every night?
That would be what, you know, most people call them a denture. We call them partial dentures because it's replacing part of your mouth. Right. So yeah, those are 2 very different things. One is it's glued in, you never take it out. The only reason it would ever be taken out is if it failed or you got a cavity on one of the teeth supporting it and you have to do something about it. And that's one of the disadvantages of the bridge is you go in, it's still a significant investment in your mouth to do a bridge, and then you have a cavity on one of the teeth supporting it. Well, now you may need to replace the whole thing. Instead of if you've got a couple implants and there's an issue, those can usually be retrieved. They're retained by screws, so you can go in, you can clean it up. It may not be pain-free or it's still another step, but again, long-term wise, the implants are going to cost you less.
In the long run. They may cost more up front, but in the long run. And I think also people are going to be happier, don't you? I mean, especially if it's the front of your mouth, you've got to have something, you know, nice going on.
Absolutely, and I should say now there are people that are happy with all 3 options. Right. You know, you meet people that have them and that love it. Just from our perspective as dentists of what we see, the happiest ones are the ones that go for what is the best long-term fix. They can eat like they always did. They can keep them clean. They have fewer issues. That's why long run implants are going to be better.
And what I'm thinking at the moment is just because something's cheaper up front does not necessarily mean that that's the best option. I mean, this is something that you're investing in. You're investing in your smile, which is the first thing that people see about you. You're investing in being able to eat, which to most of us means quite a lot.
Yeah, well, we all eat every day, right? And so
you wouldn't skimp on, for example, we were talking about if you were buying a car, you wouldn't necessarily go out and get something that the brakes weren't functioning or, you know, something else major was going on. You would take the money and make the best investment that you could. Perhaps the cheapest option is not always the best option.
Sure. I mean, we want to make sure whatever we do, whatever route someone decides to go, that it's going to last. That's what we care about, is that whatever we do for you, you're investing your resources in your smile, in your ability to chew. We do it right. And yeah, we also want it to last the longest. Right. So I'd prefer that we fix this once and we never have to touch it again.
Well, I mean, it is an investment in yourself, and sometimes we forget to do that. We're, looking after our children, our parents, or whatever. You forget to invest in yourself, and I think perhaps of a car. If you went to buy a car, you wouldn't necessarily buy the cheapest car because it might be a clapped-out old piece of, junk. The brakes may not work, the electrics may not work. So sometimes we need to think of our own well-being as that. We want to put some money sometimes into what's going to be the best for us and what's going to last the longest, not the cheapest.
Absolutely, and obviously it's a very individual decision.
Right.
But we can help you, or you need to discuss that with your dentist. What's your individual situation? How are the rest of your teeth? What other issues are you dealing with? There's a lot of things that go into that to make what's the best decision for you that is going to last, also to meet your expectations and satisfy you, because you and I may buy different cars for different reasons.
Right.
But I feel responsible to make sure you know what's the best.
Right.
And let's work from there so that at least we know that we're all happy and we were well informed in what we decided to do.
Okay. And we're able to make an intelligent decision, because none of us want to walk around looking like toothless people. Tell us where we can find aspendental.cameron, and how does this process get started?
Yeah, so it starts with a phone call, okay? 753-4400. You set up an appointment so that we can sit down, maybe take some records and have the discussion. What are your priorities? What are your needs? And what do you want? Okay. So that we can then help you see which of these options is best and how it can work for you. Okay,
so you come into Aspen Dental. They're not going to talk you into anything. They are going to sit and discuss with you what's the best option, right?
Absolutely, yeah.
So Aspen Dental, if you need a bridge or an implant or anything of that nature, come in and see Dr. Cameron and his staff here at Aspen Dental. Thanks, Dr. Cameron.
Thank you.